In today's video, we are going to discuss our go-to method for alleviating joint pain and pinched nerve type symptoms, and that is the McKenzie method. Here at TruMotion Therapy, we specialize in the conservative management of musculoskeletal pain and injuries. And in doing so, it is really important that we get an accurate diagnosis for every patient, that we figure out where the pain is coming from, not where they're feeling the pain, but where the source of the pain is and how we can effectively treat it. And one of the methods that we use for doing that is the McKenzie method. The McKenzie method is a diagnostic system and a treatment system. It involves using repeated joint movements to try to determine what direction the joints don't like to be moving and what direction they do like to be moving. This helps us determine, okay, where is the pain coming from and what kind of things do we need to be doing to help alleviate the pain. Now, the McKenzie Institute put out a very interesting study that looked at joint pain that did not have any spinal pain associated with it. And they tried to determine what percentage of joint pain was actually coming from the spine, even though there was no spinal pain associated with it. And the numbers were pretty staggering. They found that 70% of hip pain was actually coming from the lower back, even though there was no lower back pain. And that 40% of shoulder pain was coming from the neck, even though there was no neck pain. Now, how would you know that without going through a proper diagnostic protocol? So with the McKenzie method, we start at the spine. So if somebody has hip pain, if they have knee pain, we want to rule out the spine as a source of that pain first. So we go through a series of repeated movements to see if we have any change on those symptoms. And if we do, we know what kind of treatment we need to be giving that patient. And the cool thing is that that patient can then do those movements on their own. They can do those treatments when they go home. They know how to take their own pain away without us having to do too much to them. So a surprising amount of upper extremity or arm complaints actually come from the neck. That would then encourage us to go through repeated movements of the neck to help reduce the symptoms in the arm. We can effectively treat the elbow without ever having to touch the elbow if those symptoms are coming from the neck. You can think of this almost as a pinched nerve, right? If the nerves are running from the neck going down into the elbow and there's an issue with that nerve in the neck, it can cause pain in the elbow. We treat the neck and alleviate the elbow symptoms. The same thing can be done in the lower extremity or the legs. If we have ankle pain and it's coming from the lower back, we do repeated motions of the lower back to help alleviate those ankle symptoms. Now, occasionally we have pain in the extremities and there's no spinal source whatsoever. McKenzie has an answer for that as well. We simply go through repeated joint motions of that extremity joint. That may be going through repeated motions of the shoulder, repeated motions of the ankle to see if we can reduce pain and improve function.